Hello, my new nurses. It's your girl here once again. And I want to tell you about another one of my experience in my nursing career. One that will make you keep your eyes open whenever you are giving your patients their medication. I was about 2 years into my nursing career, and I was working at a long-term care nursing facility. And prior to my shift, one of the patients decided to overdose on his oxy. So apparently the patient was holding his oxy for a while. So days after days, when the nurses was giving the patient his oxy, he was hoarding his oxy. And no one knew that that patient was hoarding his oxy. So the night that I was working, the patient decided to take his oxy. All of the oxy that he was hoarding, he decided to take it. So I had to start my shift at 11 p.m. So prior to me starting my shift at 11 p.m., the patient took all of that oxy. No one knew the amount, but he took all of that oxy all at one time. And guess what? He coded. So in a long-term care facility, I have to call 911. There were no Narcan in that long-term care facility. So the paramedics came and gave that patient Narcan, and he revived. And they had to take him to the hospital. So my new nurses, whenever you are giving your patients their medication, make sure they are taking their medication. Give them with enough liquid. Do not turn your back on your patients while you are giving them their medication, especially the NOx. Make sure they are taking their medication. Make them open up their mouth. Ask them to open up their mouth. Okay? Because patients have a tendency, especially the ones that OD, they have a tendency of hoarding their narcotics and then taking it in a loathsome. So prior to whenever they're taking their medication, make sure you are watching them. Be vigilant. Have some critical eyes and make sure they're taking their medications. Okay? Because the ones that OD, they hoard it. And then they take it in a loathsome to get a higher effect. Okay? So my new nurses, another tip for you is make sure and be vigilant at all times that your patients are taking their medications, okay? And drop a comment if you ever have such an experience with a patient that overdosed on some oxy or another